I was introducing myself. My name is Hesham Khalil. I'm a doctor of osteopathy, graduated from Canadian school. Okay, today's lecture is about what is the relationship to explore the link between our emotions and our body aches or body reactions or somatic dysfunction. We call it somatic dysfunction. Soma, it means body framework, like bone, joints, muscle, and so forth. So in order to explain the point of view, we have to introduce first what is osteopathic medicine. Osteopathic medicine is a model of medicine which is actually created in the United States a long time ago, 1874, by a military physician with a big tragedy. This guy lost three of his kids for typhoid and other things. Then he went into depression, like most of human would happen to them. After some while, he decided to revisit the model of medicine at this time. We talk in 1874, like before the penicillin, before the whole modern medical advancement and development we live in this right now. So he started to steal the cadaver from the graveyard to try to explore what can be done in the human body through re-exploring the body from anatomical, physiological point of view, until he found out, like he discovered what we call it lymphatic system. This time it was a discovery. Now we talk about now everybody knows what's lymphatic system. Then one day he decided, okay, how we can help children. He was so intimidated by like diseases because he lost three of his children, like he was traumatized, let's call it this way. So he was always thinking about how I can help children of his community. Then he started to think about what I can do with my hand. This is how the osteopathy starts, to improve the immunity of the kids. Then after discovering the what we call it the lymphatic system is so deep inside, the major lymphatic system. So he came up with the idea of mobilizing the spine to achieve certain motion into the lymphatic system. He kept trying and trying and trying until he came up with the whole model of medicine at 1900. He founded the American Osteopathic Association. He wrote like 5 books talking about how we can help immunity of the kid with various issues. Then we came to a big breakthrough, 1918-17, the what they call it, the pandemic flu. If you remember those, if some of you understand like the COVID, but they call it then it's bird flu. Yes. The statistic out of this situation or this event shows like the mortality rate out of the hospital, in the traditional hospital, like 53% of people dies of every 100 person get hospitalized, versus an osteopathic sanitarium 0.5%. So like every 200, one dead person, one person dies, versus 53 that we're actually started to put the attention of the politician. So at the Roosevelt presidency, they decided osteopathy should be a full licensed physician. So now we have 50 states, osteopathy is a full licensed physician. All right. Osteopathy is a medicine based on the theory that disturbances in the musculoskeletal system affect other bodily parts, causing many disorders that can be corrected by various manipulative technique in conjunction with conventional medical, surgical, pharmacological, and therapeutic procedure. So, osteopathic medicine believes that if the musculoskeletal system influence every other system in the body. So if we have any dysfunction or issues with the musculoskeletal system, will definitely affect other systems like respiratory system, gastrointestinal, and things, and everything else. And these techniques created to manipulate the musculoskeletal system, which will affect or improve the healing of other systems, can be used with conjunction, surgical, pharmacological, and other therapeutic procedures. In order to understand the concept, we have 4 principles. The first principle is the human body is one functional unit: mind, body, and spirit. Most of the medical school do not believe in the 3 together. Like, as you know, spiritual part usually it's like out of the equation, because medicine is about numbers, and you know what I mean. Spirituality is kind of a little bit out of this. The second principle is form and function are interdependent. Form and function here means the anatomy and physiology are interdependent. Means if you have an anatomy here, like the structure of the body, if your body is not structured well, there is no way it will function well, and vice versa. The third principle, the human body has the innate ability to self-heal. Like all what we're doing in the medicine is trying, in the osteopathic model, is trying to enhance the self-healing ability of our body. So we actually not just trying to give patient medication or do surgery. The first priority of the osteopathic medicine to improve the self-healing of the human. Of course, like eating the right food is helping, doing the right meditation is absolutely privilege, but the main cause or main reason or main purpose of osteopathic medicine to improve the self-healing ability of the body. Treating body, most of the time in medicine, when we have back pain, if you have a back pain and you go to the doctor, the first thing the doctor will ask you to do is the X-ray or MRI or try exercise. In reality, in osteopathy, when we have a back pain, the first question comes to the doctor's mind is, what is the possibility of why this person in particular could have back pain? In traditional medicine, we think about, let's say somebody have a low back pain. In medicine, we think about lumbar spine, disc, sprain, strain, and so forth. In osteopathic medicine, this is a small part of what we look at, but in reality, we look to the bigger picture. We look to those patients in a holistic way, starting from something simple like muscle strain, maybe from coming from referred pain from the intestine, dysfunction in the liver. Women with multiple C-section may affect the structure of the pelvis, where it can create a center of gravity shift, knees issues, whatever possible to create back pain. So in osteopathic medicine, the main reason, the main purpose to create what we call it root cause diagnosis. Like we need to figure out why this person in particular having that back pain today. So we don't really follow the traditional model going through the book like signs, symptoms equal diagnosis. No, we have a very personalized way of diagnosing every person, very customized, personalized way of diagnosing the patient. So let's say, for example, when we're talking about back pain, we don't look to the back as a bone like most of us as a doctor or physician or physiotherapist. We look to the attachment of the possibilities we look also into the nervous system quite in details. Attachment and the mechanical link in the osteopathic medicine is quite important thing to investigate. For example, this is the inferior view to the diaphragm, and if you look to the diaphragm here, it's like have attachment to the spine. And somebody with shock, what would you think about that? What can happen to the diaphragm? What happens when we are shocked? The diaphragm becomes spastic, like spasm. The diaphragm has 3 holes, one for the major blood flow, like the aorta. The aorta, this is like the main artery, comes out with oxygenated blood going to part to the head, part to the abdomen, and so forth. So imagine like if you get some contraction around the aorta, what will happen to the blood flow? The second hole is the vena cava. This is the oxygenated blood from the whole body, I mean lower body, coming out through the diaphragm. So if someone have a diaphragmatic spasm, that will create swelling in the lower extremities. So instead of looking into the, what to call it, little things, like every doctor look at it, we look at every more of a mechanical relation in every single patient. The third one here is for the stomach, the esophagus. The esophagus goes through the diaphragm. So just visualize for a second if someone in what we call it cannot breathe, or having shock, or I don't want to call sad or depressed, how this will affect the diaphragm. Can you imagine? Just visualize for yourself. Close your eyes and feel how you sit right now. Most of us sitting like compressing the liver. Yes. So in osteopathy, we think about how we can change the physiology through correcting the structure, which is the anatomy. Why I'm giving you that little example about the diaphragm, because somebody I see a lot of patients with high blood pressure without no pathology. They have no pathology, just need to be breathed right, just need to relax their diaphragm through whatever meditation. I don't care about the tool, I care about the methodology. So people with hiatal hernia, which they have GERD, like they call it gastroesophageal acid reflux, like with a lot of burning sensation. We misdiagnose them most of the time with heart issues or vascular. Usually if we fix the diaphragm, will help their acid reflux. With people with congested abdomen or pelvis, especially in women, if you clear the diaphragm, you clear the highway to the return blood flow and so forth. This is a view of like a cross view in the sternum, like cross, like a longitudinal. Like this is the heart, this is the spine, this is the big vessels, and this is the sternum right here. If you look at this picture, it's a beautiful picture. It shows how the heart is enveloped with what we call a pericardium. Pericardium, this is very strong membrane, protects the heart from enlarged, because the heart is about the strongest muscle in our body. Imagine if this muscle keep going without control, the heart will go in size, it'll grow in size for unlimited size. Think of this. We usually see this picture. We visualize this picture with people with, let's call like post heart surgery or a quad bypass, like the one where we like having heart issues and the blocked artery. Can you imagine? Most of those patients comes with after surgery, they come with their pericardium attached like this. So they create like a hump. The hump affects their breathing. Eventually, they will complain about neck pain because of what happened to their posture. Same thing happened with women post C-section, like after the second, third C-section, woman becomes pulled this way. Those women, we see them with often cervical pain, which is not related to the cervical spine, it's related to how they sit and how they've been pulled, and so forth. So there is a lot of examples trying to, this is like most of the vital organs in our body protected by the viscera, protected by the cage, kidneys, spleen, liver, lungs, heart, and so forth. So when we treat someone, we need to visualize the relationships between the organs versus its function versus the mechanic of the body. This is a big issue we usually don't consider in the traditional medicine. We call it like the innervation. All organs, no exception, get their function through the central nervous system, through what we call it autonomic nervous system. Autonomic nervous system, it's divided to sympathetic and parasympathetic. Sympathetic when we are angry, when we are like rushing. It's like it works with the hormonal system. Let's go back a little bit from this point. How we regulate our function, how we live, let's call it this way. In order to live balanced, you have to have three things: good posture, good hormonal system, and good autonomic nervous system. Hormonal system is mastered by something called the pituitary gland in the base of the skull. This is the pituitary gland. The pituitary gland, the master of all hormones. So if your body is not balanced, there is no way the pituitary gland will function in a proper way, where we start feel like people with more like the one with emotional stress will manifest diseases like thyroid, like diabetes, like kidney issues, and so forth. So the autoregulation our body, which is a gift from God, we created with self-healing ability. Self-healing ability like depends on the autonomic nervous system and the hormonal system, nothing else. So if your hormonal system is not regulated, there is no way you will heal by yourself. That's why in osteopathic medicine, the first priority to try to figure out what could affect the hormonal system or autonomic nervous system in order to create the good environment for self-healing. I will repeat this part again because this is the core what we do in osteopathy. What we do in osteopathy is to use the mechanical part of the musculoskeletal system to make sure that the hormonal system and the autonomic nervous system able to function independently or self-heal. Otherwise, our body, there is no way to self-heal. If you, for example, if you cut your hand or anything happened, you even get infected, how would you heal by yourself if your hormonal system is not aligned or autonomic nervous system is not aligned? Let me put some spotlight on autonomic nervous system. Autonomic nervous system is actually divided into sympathetic and parasympathetic. Sympathetic is actually located physically in front of every single rib. So the sympathetic system is located between dorsal spine number 1 until L2. And the parasympathetic system is a craniosacral, like part of it from in the cranium and the sacrum. So imagine if someone get a car accident like myself and was crooked for posturing for a while. What's going to happen to the sympathetic flow, parasympathetic flow, and hormonal flow? It will get messed up. Most of the people with car accidents, especially whiplash and injury, they suffer from, we call it AFib, atrial fibrillation, or a bad rhythm in the heart. So when they go to the cardiologist, the first priority of the doctor will be to write them a blocker, like to give them a beta blocker to slow down the heart. But reality is, the problem is most of the time it's related to the sympathetic system, which is the root of that sympathetic, given the heart to regulate the heartbeat is affected. You see where I'm coming from? People with, like, most of the diseases can be treated through aligning the musculoskeletal system in order to relieve the pressure from sympathetic or autonomic nervous system and hormonal system. This is example what happened to this called autonomic nervous system. This is when we have a like sympathetic flow versus parasympathetic flow. This is parasympathetic, this is sympathetic. So the sympathetic, in effect, it creates dilate bronchi, speed the heart rate, adrenal secretion, decrease secretion in the stomach and the small intestine, decrease motility, so it creates like constipation, so forth, retain colon like constipation, delay everything, same thing. On the contrary, parasympathetic will do the absolute opposite. So I want all of you to think about yourself and what kind of dysfunction you may have, so that will reflect where you should pay attention next to in your body. Like, is you have a sympathetic overflow or parasympathetic overflow. This is another important thing. We call this part fascia. Like, we are connected, all our body is connected with what we call it fascia. Fascia in the normal state divided into three parts in our body. Superficial fascia, which is form how we look, like this is the underskin, like how your skin look like, or how skin felt like sagged, fully, whatever. The second part of fascia is called deep fascia, which is most of our body, and this is influence the posture. The third part, or third kind of our fascia, is called subserosal fascia, which is gliding or responsible about gliding all our organs inside out. So if we get severe fever or maybe bad gastroenteritis or maybe pneumonia, God forbid, what will happen to the fascia? It will become sticky. Can you imagine the situation like now? So that stick, like what we call it fascial dysfunction, or instead of the fascia helping to glide the organ over each other, that will create restriction. Restriction will affect the function. This picture in particular, it's along with the cage, like the thoracic cage, and this is a little fascial adhesion or scar. Imagine if you try and take a deep breath and you're not able to take a deep breath. You need to fix this first. This is the job of us osteopathic doctor, to figure out how we can improve the function without giving you so much medication or take you through surgeries. I hope you get the idea here. Another thing we look into in osteopathy is what we call it referred pain. Most of the time, physicians don't pay attention to this. Even it's like evidence-based medicine. It's all in the anatomy book or physiology book. Some areas, like I got myself a lot of patients with pain in this area. And we keep taking them for therapy for years, and it will never get better simply because this pain comes from an organ inside, which we call it referred, means it's not coming from this place, it comes from somewhere else. Like if you look at the lung, and the diaphragm can give you to that left side of the neck, liver and gallbladder give this side of the neck. Imagine how many patients can be treated for neck pain, but it's not in the neck. It's usually from an organ reflecting the dysfunction outside of the body or outside. It's like, it's alarm. Like the heart is like saying, flag out, I am in distress. But most of the time we don't look really into this stuff. I hope you can take picture of this, because every one of you, I would like you to go back home and check on yourself and check on your kids and see if you have prolonged dysfunction and has not been treated for some time. Could be a guideline for you to dig into what is actually possible. Look at the colon, kidney, ureter. It's like crazy map. Okay, let's go now to the human body. It's a well-oiled machine. We are not equal where viscera, now I'm talking about the viscera. All the introduction was about the relationship between viscera, organs, and our body. But are we the same? We're not the same. We are unique. Nobody is like any other body. So when we decide to look into a human body, we need to look at it with perspective, so we are tissue oriented, not organ oriented. I was trying to convince you that organs is so important, but it's actually important to give us like how we can be affected by organs. But reality, we are tissue oriented. Like an organ can have more than one tissue. And every single tissue of us in our body respond to certain emotion. That's the core of what I'm trying to say today. So the key point of today is, even we are organs, viscera, and musculoskeletal system are organized and well-oiled, but reality is, for example, fascia, it's a storage of our emotion. Like if you're driving Lebanon Square for like 20 minutes, I will talk about myself. Like by the time I'm arriving home, I have a very contracted trapezius muscle. Okay, I am arrived home already. What happened to my trapezius? Relax. But what about what happened to the fascia? It's still contracted. Day after day after day, you develop your, we call it fascial dysfunction, which is affecting everything else in our body. There is certain organs absorb certain emotions. For example, liver. Usually it's sadness, big time. Kidney, fear. It works both ways. We can work treating the mind, we can influence the body. If we treat the body, we influence the mind. So the key behind the lecture today, if we cannot do it psychologically, let's do it mechanically. Yes. Thank you so much.